At the beginning of the pandemic, restrictions like masking and physical separation helped to slow transmission, prevent overcrowding in hospitals, and buy time for scientists to develop effective vaccines and treatments. However, a growing number of healthcare professionals believe that restrictions and mandates are out of date and, in some cases, even overkill. Hi, today we will discuss how COVID-19 restrictions are affecting our lives and what health professionals think about this. Dr. Jean Noble said, "In the beginning, we had no other tools in how to deal with this, but it's the time. We have kept restrictions going that really highlights the fact that there has been very limited discussions in the harms of the restrictions, which has allowed policymakers to keep them in place way beyond when they were possibly effective." Dr. Monica Gandhi, professor of medicine at the University of California, San Francisco, agreed. Prior to vaccines, she said public health officials did everything in their power to limit transmission since cases could lead to hospitalizations among vulnerable people. However, since the advent of the vaccines and with increasing population immunity, cases no longer track with hospitalizations but have become uncoupled from the severe disease since vaccines are so effective at preventing severe disease. For instance, recent study findings revealed that significantly lower COVID-19 incidence and significantly less severe COVID-19 cases during the Delta surge were related to higher vaccination coverage. Noble claimed that precautions like social restrictions don't make a measurable difference because the nation currently has a lot of natural or acquired immunity from COVID-19. Although daily COVID-19 deaths are increasing in some countries, they are still significantly lower than at the peak of the pandemic. Why spikes in cases shouldn't cause alarm? According to the CDC, the highly transmissible BA.4 and BA.5 subvariants of Omicron, which started predominating in the US in June, are largely to blame for the rise in COVID-19 cases. The reason that cases rise and fall so predictably is likely because new infections generate antibodies in the nose and mouth, called IgA mucosal antibodies, which prevent onward transmission to others, leading the cases to eventually die down, explained Gandhi. Dr. Bruce E. Hirsch, an attending physician and assistant professor in Northwell Health's Infectious Disease Division in New York, divided this science into two parts to explain it. Number 1, transmission. The variants are gaining the ability to spread more effectively, and some of the new variants are gaining the ability to evade the immune response of the previous ones. So, we've seen people who've had COVID more than once, and it seems to be the more current variants like BA.5 that are able to infect a person who developed an immune response to an earlier COVID variant. Number 2, severity of disease. The severity of the COVID variant is determined by how effective it is at finding sites in the lower respiratory tract as opposed to the upper respiratory tract. According to Hirsch, the current variants are really good at infecting the nasal pharynx, and not so effective at causing pneumonia, which is much worse to have and can affect a person's health in adverse ways. Why ongoing restrictions are overkill? Gandhi believes that current restrictions should be lifted. One reason she cites is that COVID-19 cannot be eradicated because animals can harbor the virus, making it impossible to make animals immune. Moreover, the symptoms of COVID resemble other pathogens and it has a relatively long infectious period, she said. When it comes to masks, she stated, given that more than 30 states in the US have not had any mask mandates since spring of 2021, with the remainder of states discontinuing mask mandates a year later, but that cases rose and fell in the same pattern across states since the advent of vaccines, I don't think we should resume restrictions like mask mandates at this point in the pandemic. The CDC decided not to recommend masks in February 2022 unless hospitalizations from COVID-19 were high, which Gandhi agreed with. Mandates on vaccines should no longer exist either, according to Noble. It's hard to make a strong argument whether vaccine mandates were an effective tool. There is variable reasons, but a vaccine mandate does not equate into 100% of a population getting vaccinated clearly, said Noble. It's debatable to say why they weren't, but there will always be resistance to something that is forced onto people. Time to face the harms of restrictions. In 2021, Noble became concerned about the impact COVID-19 restrictions and mandates were having on mental health, particularly the negative effects on children's lives. While she remained committed to caring for COVID-19 patients, she began weighing the costs and benefits of preventing people from working and depriving them of some of their education and childhood. The COVID-19 pandemic brought attention to the youth mental health crisis, and the U.S. Surgeon General issued a warning about it in December 2021. A July 2022 study that appeared in the Journal of Adolescent Health examined the relationship between perceived changes in Texas area adolescent mental health and substance use, and the financial impact, stress, loneliness, and isolation brought on by COVID-19. Doctors encourage continued caution. While many in the infectious disease community acknowledge that the pandemic response caused significant suffering and isolation, many argue that a balanced approach to fighting the virus is still required. Hirsch stated that precautions such as appropriately wearing high-quality masks, effective ventilation, vaccination, and improving one's personal health must all be implemented in order to strike a balance between the risks and benefits of being together. I want people to be able to see each other with the needs of the vulnerable among them respected. Some healthy people who do not consider themselves at risk for any illness will have long-term health consequences from COVID, he said. He thinks a few more years are needed before COVID-19 is like influenza and the common cold. The virus is not done with us. It's still changing and it's continually evolving. We don't know what future versions of the virus are going to mean for the health of ourselves or for the population, Hirsch said. He acknowledged that those in the medical field, like himself, who experienced the worst of COVID-19 in 2020, have painful memories of those early days that are particular to their line of work. We saw an unbelievable magnitude of death and frequency of severe illness in the beginning of the epidemic. I saw a lot of people die when our strategies and treatments were uninformed and not nearly as effective as they would be afterwards, he said. When COVID-19 hospitalizations are low, he thinks society should act as normally as possible while still being on guard against potential variants. So, that's it for today. Before you go, please don't forget to like, subscribe, and turn on notifications for our channel so you never miss what we post next. Thanks so much for watching.